So let's jump into some common questions, Dr. Suarez, that come across the table all the time. And I know you hear it all the time. I hear it all the time from my patients. Most of my patients are asking whether I think that they should or shouldn't. Is it time for them to have a total joint replacement? And we see it all the time. So let's start off with the question, why does the hip degenerate? Like, why do we see this? The knees as well. We can focus a little bit more on the hips today, but what is that takes place?
So when, us surgeons, when we talk about arthritis or degeneration of the joint, what we mean is that the cartilage or the cushioning of the joint wears out. And as it wears out, then you don't have any cushioning left. And then the joint starts rubbing bone on bone, and that friction creates pain, inflammation, stiffness. Now, the reason for that could be from different reasons. For example, it could be from trauma, like in your case. You had what we call post-traumatic arthritis. A traumatic event led to dysfunction of the joint, which led to degeneration of the joint. You can have an autoimmune disease like rheumatoid arthritis or lupus, which basically your own body attacks your joints. And that chronic inflammation breaks down the cartilage. There's also people with anatomic variations like dysplasia of the hip, where the socket of the pelvis is not formed completely, so it's shallower. So what happens in those situations is that there's abnormal stresses on the joint, and those are normal stresses over years that leads to degeneration of the joint. But the most common one is osteoarthritis, which is basically what we call wear and tear. And we really don't know exactly the etiology of it. We think it's a lot to do with genetics. But basically, your joint starts breaking down over a period of time. And then, again, the cushioning breaks down. You start rubbing bone on bone. And then you end up with an arthritic hip or knee, for that matter.
So mythbuster number one is, do you need to see the cushion gone to justify the surgery, or are there times when you'd go ahead with the surgery even if you didn't see the bone on bone? Would there ever be a reason to do that?
So there's data, especially on knees, that try to correlate different variables to unsuccessful results. And one of those variables is the knee not being bone on bone on x-ray. Meaning if you pull the trigger too early, then you may be paying the price for that. Now, there are situations, for example, on the hip where you can have osteonecrosis of the hip, or, in the same way you can have a heart attack, you can get that in the hip and it's not bone on bone, but there's a different process going on the bone.
And just to explain that necrosis is where tissue dies. So if the artery that goes into the head of the femur is damaged to where there's no longer blood getting there, no blood supply, the bone's dying, and that's going to be a problem. We've seen that with a number of professional athletes as well that have had major trauma or dislocations and ended up with avascular necrosis in the hip. So,
but a very common scenario is people are like in the twilight zone, right? They're not bone on bone. They come with an MRI. The MRI of the hip shows a labral tear, mild arthritis. You examine them. It's an intra-articular pathology that's causing the pain, but you're like, well, I don't think you're ready for a hip replacement. And a lot of people fall in that category. And the question is, how can we make them better and try to prolong the life of their normal hip?
let's